Bismillahirrahmanirrahim. Symptom of cough. When the patient is complaining of cough, should take history. Cough is a very common symptom. It may be caused by mild or self-limited illnesses such as common cold, or can be due to serious respiratory disease such as lung cancer. It's essential to establish the duration of the cough, whether it's productive of sputum, and whether there are symptoms suggestive of serious disease such as hemoptysis, breathlessness, chest pain, or weight loss. Examination. Examination in a patient complaining of cough. What is the color? We should first ask about the color and the amount of sputum and any blood. Is there evidence of serious acute illness? If there is fever, tachycardia, tachypnea, chest pain, or breathlessness. If there a history of chronic respiratory disease, are there features of sinusitis, maxillary, toothache, purulent nasal secretions, or facial pain? Are there systemic features suggesting serious underlying illnesses such as weight loss, fevers, anorexia? Are there any features of pertussis, such as post-tussive vomiting, respiratory whoop, paroxysmal cough? Is the patient smoker? Is the patient a smoker, either current or ex-smoker? Had the patient been exposed to particular infectious agents such as pertussis, allergens, or new medications, especially angiotensin converting enzyme inhibitors, ACE inhibitors? Carry out a full respiratory system examination. Are there any signs of consolidation, pulmonary edema, clubbing, or crackles? Then the causes of hemoptysis include bronchitis, pneumonia, pulmonary embolism, pulmonary edema, lung cancer, bronchiectasis, pulmonary hemorrhage, such as Goodbasher syndrome, mitral stenosis.